Good morning, everyone. Uh, Good morning, everyone. Hello, our respected speakers, participants, and our dear colleagues. I would like to welcome you all to our events. This event, the role of pharmacists in the prevention and the management of vector-borne diseases as a perspective from Eastern Mediterranean region. So, first, I would like to introduce myself. I am Nadia Al-Mazroui. I am assistant professor in department in pharmacy college in University of Sharjah. Also, I am president of Embryo Farm Forum, and I am a member of expert advisory panel and pharmacopoeia in pharmaceutical preparation in the WHO, member of one FIB Data and Intelligence Commission, member of identifying and addressing the multinational education and training needs of the pharmaceutical workforce, METANA. Also, I'm teaching in board of pharmacy specialty, ABDS, formal deputy director of military medical services in UAE, and I'm the vice president of ABS, Merit Pharmacy Society. I've been really honored to moderate this valuable event, which is the role of pharmacists in the prevention and management of vector-borne diseases as EMR, from EMR perspective. Vector-borne diseases comprise a long list of illnesses caused by virus, bacteria, or parasite transmitted to human by a number of vectors, including insects. They account for nearly 1/5 of the infectious diseases and cause over 700,000 deaths. So every year around the world. In addition to the health burden of vector-borne diseases, the economic impact is enormous, especially so because they disproportionately affect the world's poorest countries. It is estimated that 80% of the global population is at a risk of developing at least one vector-borne diseases. Next, please. So, a crucial element in reducing the burden of vector-borne diseases is behavioral change, which can be achieved through education and by improving public awareness. Because pharmacies are trusted and easily accessible, they represent important key players in the multi-sectoral approach to effective vector control and the prevention and management of vector-borne diseases. Pharmacists' experts in medicine, and their vital role with health care teams, pharmacists are well equipped to be act as advocate, educators, and providers in the collective endeavor of preventing and treating vector-borne diseases, especially the low and middle-income countries, where such diseases are often more prevalent. Next, please. So, in the light of these statements, I would like to welcome our speakers, distinguished speakers for today, Professor Rula Darwish from Jordan and Professor Dr. Nidal Khazal from Iraq and Dr. Yusuf Sabil from Sudan. Of course, I would like also to express my gratitude to everyone who attend this event. Now I'm going to introduce the co-moderator, Dr. Wael, and he will give us an overview about the role of pharmacists in EMA region and especially with development to FIB development goal strategy. So Dr. Wael, please can you introduce yourself? Thank you. The floor is yours.
Good morning, Dr. Nadia. Good morning, our colleagues. Thank you so much for introducing me, and thank you so much for attending this webinar. My name is Wael Ali. I'm a president of Egyptian Organization of Pharmacy. I'm General Secretary of Embryo Farm Forum. and I am consultant in the Faculty of Pharmacy, Sharjah University, and monitor consultant PharmaBridge Project FIP. Let me first introduce what is the Embryo Farm and the role of the Embryo Farm for transforming pharmacy profession in the Embryo region under umbrella of FIP. Embryo Farm is a platform for professional cooperation in the Embryo region, Middle East region, with the aim of enabling the pharmacy profession to have a greater impact on improving the health and the efficiency of the health through pharmacy services. The Embryo Farm also organize professional and educational program to promote good pharmacy practicing and strengthen the pharmacy workforce in Embryo countries. What about the Embryo Farm countries? We have 22 countries here in our region. Alphabetically, Afghanistan, Bahrain, Djibouti, Egypt, Iran, Iraq, Jordan, Kuwait, Lebanon, Libya, Morocco, Oman, Pakistan, State of Palestine, Qatar, Saudi Arabia, Somalia, Sudan, Syria, Tunisia, United Arab Emirates, and Yemen. This is Embryo Farm countries. So let's go to the very important thing. FIP already launched 21 development goals. These goals aim to increase the capacity to provide a competent pharmaceutical workforce. For what? As education, training programs, they are fit for all purpose we need it in our profession. So resources needed like clinical practicing, pharmaceutical sciences area, and all stakeholders in the healthcare profession. So the FIP development goals are a key resource for transforming the pharmacy. We are looking forward to transforming the pharmacy and the profession of the next decade globally. It means this aligns FIP's mission to support global health by enabling the advancement of pharmaceutical practicing, science, and education to set this transformation with wider global imperatives, and it's a very underpinning to the United Nations Sustainability Development Goals. So we are looking for one FIP. One FIP development goals enables to identify common across areas of all of FIP. Right now, we are not only the pharmacist, we have a lot of points. So FIP already launched the 21 development goals, which bring science, practice, workforce, education together for what? For transformation state and the transforming framework for our members and wider profession to be clear out the goals for development for the next decade. So it's kind of roadmap of that. That's why we launched it already first to address the challenge of vector-borne disease. FIP launched a series of webinars, and this webinar, one of them, we started already in America on Wednesday, April 21st, and then to Africa on May 20, and then we are here in Embryo region Monday, June 21st. Then we will go to the Western Pacific. It will be July 22nd, then Asia in August 19, and finally in Europe, September 10th. So, on the order to make like a more supporting the pharmacist in managing the Victor-Borne, FIP already published on the 4 languages, English, Spanish, French, Portuguese, and we are looking forward to the Arabic publishing for the Victor-Borne disease to support the pharmacist, the guidelines of the Victor-Borne disease. As Dr. Nadia said, it's a huge impact in that area. Please, this webinar is being recorded and live streamed via YouTube right now. The recording will be available on our website, www.events.fib.org. You may ask questions using the question box. You can do that provided already. You are welcome to provide feedback to webinars@fib.org. Please become a member of FIP, it's very easy. Just click www.fib.org membership registration, and you'll find all information you're gonna need it. What the benefits for me as let's say like we have two kinds of membership. It's personal and organization. So if you have organization, you can click organizational membership, and if you wanted to make it like a personal membership, you can do it right away, please. So let's back to Dr. Nadia to start our webinar right now, please.
Thank you, Dr. Weil, for your nice introduction.
Thank you.
And now we will speak about our today program, which is we have the role of pharmacists in the prevention and control, management and treatment of vector-borne disease in Eastern Mediterranean. Also, we have the role of pharmacists in vector-borne diseases from the industrial approach, and also some successful experience from Sudan, discussion, and then we will get the conclusion in the end. So let me, next slide, please. Yeah, we have some learning objectives that we have to recognize the main concepts related to vector-borne diseases, and also we have to describe the characteristic of morbidity and mortality of the main vector-borne diseases in Eastern Mediterranean region, determine the activity that the pharmacist can develop from the pharmacy, from the prevention, detection, control, and management of pharmacotherapy of vector-borne diseases. Next slide. So please allow me now to introduce our first speaker, Professor Rola Darwish. Rola Darwish is a professor in pharmaceutical microbiology. She got her PhD from King's College from London. She is the former Dean of School of Pharmacy in the University of Jordan. She is WDH9 lead in FIB, and she's a member of the executive committee in the academic section in the FIB, also Accreditation Council for Pharmacy Education, the ASCPE, and also in the advisory group ISPAG. She's also the chair in CBD, in Jordanian Pharmaceutical Association. Dr. Rola, Professor Rola, she's going to give us the fair. Please start, the floor is yours, and you are welcome to start your lecture. Thank you very much for your sharing.
Thank you, Dr. Nadia, and it's really a pleasure for me to be here among you all, dear colleagues. Our talk today will be on vector-borne diseases in the Embryo region. But before I start my talk, I like to quote this statement: "It is a small bite, but it is a big threat." Next slide, please, Annika. So what is vector-borne diseases? They are diseases that are spread by arthropods or small animals. We call them vectors. The disease can be viral, bacterial, or protozoal. As for the vectors, they can be biological. Some part of the cycle happens inside the vector, or they can be merely mechanical. That is just they transfer the disease mechanically from one person to the other. Now, if you look at the transmission type, we have two major types. One is from human to vector, then to human, and we call this anthropootic infection. Examples of these, we have malaria, dengue, and yellow fever. And we have the other type, which is from animal, vector, then to human, and we call this zoonotic infection. And this is example of these diseases include Lyme disease, hantavirus, and others. Now, these diseases, they are widespread. However, they didn't receive as much attention as other diseases. That's why they gained the reputation and the name of neglected tropical diseases. Next slide, please. Now, if we look at the incidence of the spread of these diseases, you will notice that it is spread not evenly worldwide. It's different from each part. And if you look at the scale here, it represents number of the vector-borne diseases from 0 to 6. And it represents, the color indicates the number of vector-borne diseases that pose a risk in 25 kilometers square. Now, we find that more than 80% of the global population is at risk of at least one major vector-borne disease, with more than half the population at risk from 2 or more. Now, if you look at our region, next please, Anikan. If you look at the Embryo region, you can see that there's at least 1 or 2 vector-borne diseases spread all over. And as we mentioned earlier, they are spread in 22 countries. So you can imagine how the prevalence of these diseases in 25 kilometers square. Next slide, please. Now, we said that it is a small bite, but big threat. And the threat comes from the burden. Actually, there is more than 17% of the estimated global burden of communicable diseases is associated with the vector-borne disease. And it claims more than 700,000 lives every year. And I believe this is a significant number. Again, it is not exclusive to the poor parts of the world. It is spread all over. It can happen in towns and cities, wherever mosquito proliferate. And this can cause serious problem. And the issue and the major burden, it's true that not many people might die if they have this disease, but however, they're going to left permanently disabled or disfigured, and this can affect their activity and their life. Next slide, please. Now, I like to share with you the seriousness of the vector-borne diseases. And here is the WHO map, which shows the mortality distribution. Again, if you look at our region, you're going to find that it ranges from 20 to 1,900 deaths per million. And this is a considerable number, as you can see from the map. The vector-borne diseases is very serious in that they can spread easily, can be transmitted in a large scale in shorter time than other infectious diseases where it requires human-to-human closeness. Next slide, please. Now, the burden of vector-borne diseases does not lie on the person only. It lies on government, where this burden includes the cost of vector control activities and case management. And also it lies on household, which is related to expenditure towards personal protective measures and treatment, as well as foregone income due to reduced productivity or time of work due to illness or caregiving to sick household members. Also, it can, from a macroeconomic perspective, vector-borne diseases have been associated with lower economic development. Next slide, please. Now, here is an estimation of the global burden of disease caused by major vector-borne diseases on economy. I'm not going to talk about all of them. I'm just going to concentrate on the most prevalent ones. For example, next please, Anikan. Malaria, for example, it costs 46.5 million DALI. And what we mean by DALI is the disability adjusted life year. In other words, it is the overall disease burden expressed as the number of years lost due to ill health, disability, or poor production. So you can see how much these, the malaria is affecting. Also, if you look at leishmaniasis, it is 2.1 million DALI, and this is a great burden on economy. Now, the Embryo is no different than other words. Next slide, please. As you can see here, malaria, for example, next please. You can see that the mortality due to malaria alone is 40,000 deaths. Leishmania is 5,000 deaths. But if you look at the DALI is significantly high, with 1.5 million DALI for malaria and 300,000 for leishmania. That means there is a great burden again in Embryo, like in other words, on the economy because of these diseases. Next slide, please. Now here, if we want to make like, this is a simple diagram to show dynamics of vector-borne diseases. And here we should have three crucial elements that must coexist in order to have this vector-borne disease. The first thing is the susceptible population at the top of the pyramid, as you can see. The vector, which is most often is arthropod. Again, we have many types of vectors, as you can see here. The disease pathogen itself, which can be bacteria, virus, and parasite. And these three elements should be there in order to have the vector-borne disease. However, we find that in some areas we have these three conditions. However, we don't have the spread of vector-borne diseases. And this is probably because of these countries, they have acted to prevent or eradicate the disease in these areas, or probably they have improved the health services or vector control measures. So again, if we concentrate on these three major elements, we can control the problem. Now, if you look at this diagram, you find it like it is a simple diagram with like a pyramid with three equal arms. However, the situation is a little bit more complicated. Next slide, please. If you look at the individual or the person himself, for example, there are many determinants for the disease. For example, we have the living conditions, whether he or she is living in good or poor conditions, individual risk factors associated with the person, social and economic policies which are implied in their countries, medical care, whether it is present or not present in their countries, a social relationship, his status. For example, some cultures, they have close social relationships that might affect transfer of the disease. Pathophysiological pathways, also genetic factors play a major role in determining human diseases. Not only that, we find that all these are also affected by the climate. Next slide, please. The global climate affects all these factors, and not only it affects all these factors, but also affect the arthropod itself. Next slide, please. Where arthropod, as you know, is highly sensitive to changes in temperature. They cannot regulate their own temperature. So again, all these determinants are controlled by the global climate. It's essential that we know all these factors in order to plan for a control policy later on. Next slide, please. Now here, the table shows us vectors and the diseases that can be transmitted by these vectors. I'm not going to go through all of them. I just want to highlight that vectors can transfer many types of diseases. They have, for example, we have the mosquitoes. They can spread dengue, fever, yellow fever, West Nile viruses, lymphatic filariasis, malaria. If you look at sandflies, for example, they can transmit leishmaniasis. Ticks can transfer tick-borne encephalitis, typhus, Lyme diseases. Fleas can cause plague. Flies can cause onchocerciasis. So one vector has a big platform of diseases that can be transmitted from this vector. So again, if you think about a policy, we should think about eradicating the vector. Probably this is the way we can eliminate the disease. Next slide, please. Now, I'm just going to touch on certain vector-borne diseases in the embryo which have high prevalence and can cause serious effects. For example, we have cutaneous leishmaniasis, which is a protozoal disease, which is transferred by sandflies. You can see the prevalence of this disease in our area, and you can see this small fly can cause tremendous effect. Look at the outcomes. Look at the patient's face in this case. So it has a tremendous effect, tremendous output on the patient, which can affect this life of this patient. And actually, Leishmania is considered now as re-emerging disease because of many factors, probably increased involvement of non-immune human population, probably because of natural and man-made environmental factors facilitating changes in the population of the victor and the host. Also, improvement of surveillance system with better diagnosis and reporting of cases maybe showed more cases than we used to have before. Next slide, please. Also another important disease is lymphatic filariasis, which is a nematodal disease transferred by mosquito as a vector. Again, this is prevalent in our areas, in particular in Egypt, in Sudan, South Sudan, and Yemen. And this mosquito, as you can see from the photo here, the lymph is enlarged to a large extent, and it makes it difficult for this person to be active again. Again, this can happen in the active ages of the humans. And as you can imagine, this will affect the person, the community to a large extent. And as I said, it is spread in certain countries and usually affect the active age. Next slide, please. The other disease is West Nile fever. West Nile fever, which is again a viral disease transferred by mosquito. This is distributed in the Middle East and North America as well as West Asia. There's no human vaccine for this disease. However, simple intervention can help prevent this disease, and this includes mosquito repellent, window screens, mosquito nets. So as you can see, sometimes simple measures can help in providing the protection which is needed. Next slide, please. So having talked about the incidence, the prevalence, and the burden exposed by this disease, there is an urgent need for action plan. Now, before making the action plan, there are certain points to consider. We find that for many vector-borne diseases, no vaccine is available. And also, drug resistance is an increasing threat. The vector control plays a vital role and is often the only way to prevent disease outbreaks. And this can be very simply done. Existing interventions, including insecticides, treated bed nets, and indoor spraying are very useful measures in order to prevent these diseases. Vector management programs that combine interventions and resources to target more than one disease is also a good resource. A very important issue is to invest in research to find and improve solutions to fight vectors and the disease they can transmit. That means to combat these diseases calls for renewed momentum on a global scale from global public health agencies, between countries and within regions, across government sectors, at all levels of government, and within communities and households is really important. Next slide, please. Now, I wanted to show you some success stories that have been done in the past. In 1942, the region that was focused on is Upper Egypt, and the disease was malaria. And here, vector control methods were implemented, and the effects were great. Here we have massive reduction in malarial cases, and it was really a promising intervention. Another success story, which has been done in West Africa against onchocerciasis. Here again, after implementing the vector control methods, the effect was near elimination of river blindness from West Africa. This is very encouraging stories. Next slide, please. So, to summarize, the Eastern Mediterranean region is facing an increasing burden of vector-borne diseases. And most vector-borne diseases can be prevented easily by vector control if it is implemented well. Vector-borne diseases not only affect health, but also have economic burden. And it's very important to look at this burden in order to overcome the effect that is expected from these diseases. A very important issue is that we have lack of accurate data. And we know in order to make a plan or to initiate an action plan, we should have an accurate data. Another important point that I like to concentrate on is the interprofessional collaboration. This is encouraged to overcome the problem. And pharmacists here, as a member of the healthcare team, have an important role in mitigating these diseases. Next slide, please. Now, all this called for action, the importance and the important active actions that have been done. First, the Global Vector Response 2017-2030, which was adopted by WHO to serve as a global comprehensive framework to strengthen countries' and territories' capacity to effectively manage vector and vector-borne diseases. And the main target is to include reducing mortality up to 75% and reduce incidence by 60%. Also prevent epidemic by vector-borne diseases worldwide by 2030. The WHO also adopted immunization agenda in 2030. And as we know, vaccines are a critical component of the battle against emerging and re-emerging infections. FIP also have development goals. One of them is the development goal 16. And this goal specifically aims at the development of strategies and people-centered professional services for prevention, surveillance, management, and therapeutic optimization of communicable and vector-borne diseases. And this goal, together with other goals as shown in the graph here, can work in preventing or working on plan to stop the vector-borne diseases. Next slide, please. And thank you for listening. If you have any questions, please let me know. Thank you very much. Bye-bye.
Thank you very much, really, Professor Roula, for this informative, valuable lecture. Really, we enjoy it. Thank you very much. If you have any question or something, you can write it in on the chat box, and we will do it in the last. Thank you. Now, it's my pleasure also to introduce our third speaker, Professor Dr. Nidal Khazal. She's a professor in College of Pharmacy, Al-Mustansariya University in Baghdad, Iraq. The floor is yours, Professor Nidal. You can start your lecture. Thank you very much.
Thank you very much, Dr. Nadia. Thank you very much for all the participating in organizing this very nice webinar. And actually, I'm talking about the role of pharmacists in industrial approach. The pharmacist who works in industrial factory, who is working in developing vaccines, a treatment or drug that is useful to overcome every kind of diseases and every kind or against every kind of vectors. Yeah. So a disease vector is any agent which carries and transmits an infectious pathogen into another living organism, such as from insects, animal to animal, insects or animal to human, or human to human. For example, malaria is spread by mosquito bites. And Ebola virus may spread through consumption of wild animal meat infected with Ebola. Another important one is coronavirus, which we are now, which is called the era of coronavirus. It may be borne by a bat or snake infected with this virus or eating their meat, although the source of this virus is not well established yet, and maybe it comes from another thing. Next, please. So the best way to eliminate vector-borne diseases is to find a good treatment to cure infected people, preparation of vaccines to prevent infections, and instructions for preventive procedures. The pharmacists have important roles in all these points through their work in hospitals, private drugstores, and drug industry. Let us concentrate on the role of industrial pharmacists in manufacturing the globally distributed infectious disease, the COVID-19. I'm concentrating on this because it has a lot of novel work have been created for this virus, which is also coming from a vector, animal, or anything. Next, please. What's vaccine? Actually, it is a suspension of weakened, killed, or fragmented microorganisms or toxins, or could be an antibodies or lymphocytes that is administered primarily to prevent disease without causing illness. And a vaccine can confer active immunity against a specific harmful agent by stimulating the immune system to attack the agent. And once stimulated by a vaccine, the antibody-producing cells called B cells or B lymphocytes remain sensitized and ready to respond to the agent should it ever gain entry to the body. A vaccine may also confer passive immunity by providing antibodies or lymphocytes already made by an animal or human donor. Next, please. On the personal, or what's the benefit of vaccination? On the personal level, the development of memory, B cells, and antibodies, which are capable of triggering a secondary immune response upon exposure to the pathogen. On a population level, which is the eradication of a large proportion of population where vaccinated, the herd immunity is achieved, which acts by breaking the transmission of infections or by lessening the chances of susceptible individuals coming in contact with a person who is infectious. So herd immunity played an important role in the successful eradication of smallpox, and vaccination also is a vital preventing the spread of disease such as polio and measles. So it is good. The vaccination then, it should be good in eradication of COVID-19. Next, please. The next, please. So vaccine industry or production has many challenges and innovations. Vaccine delivery system, it means how we manufacture or how we prepare the content of that, may contain liposomes, emulsions, microparticles, and others. But an important factor is the stability of that, the route of administration of that vaccine, how we are going to give it intramuscularly, intranasally, orally, whatever. And the storage conditions, as well as the type and the duration of immunity, depends mainly on the way the vaccine produced. Next, please. Next. Next, please. I think there's an animation happen. Yes. Thank you. So there are many technologies for vaccines production, how we produce them, how we manufacture them. So either we use attenuated whole agent vaccines, such as that used for measles and tuberculosis, or inactivated vaccines such as that used for rabies, polio, and cholera. Subunit vaccines such as for acellular pertussis, or we can get the toxoid from that viruses and or bacteria. Then we use it such as that used for tetanus and diphtheria. Or we can use a recombinant DNA technology, which is used before for smallpox, human papillomavirus. So, or naked DNA technology, as it is for West Nile, for horses, or the genetically modified vaccines, such as that for rabies virus enveloped protein. And the last one, which is the most novel one, we use a messenger RNA vaccine that is used by Pfizer, BioNTech, and Moderna for production of virus vaccines. Next, please. In general, there are vaccines against bacteria and there are vaccines against viruses. And the latter provide a special important immune protection since unlike bacterial infections, viral infections do not respond to antibiotics. So virus vaccines have to be immunogenic, sufficiently stable, safe, and suitable to induce long-lasting immunity. I'm concentrating on vaccine against coronavirus because it has a lot of innovations and challenges, and I actually involved in some of these research, and I meet some people who works with this type of vaccination during my study. The recent progress in the development of coronavirus vaccines focusing on two zoonotic coronavirus, the severe acute respiratory syndrome, which is called SARS-CoV, and the Middle East respiratory syndrome, coronavirus, and both of which cause deadly disease and epidemics in humans. The main companies that produce COVID-19 vaccine differ from each other by what? By the type of technology used to prepare vaccine, which I already presented, and the stability of their vaccines at the storage condition, and to whom each type of vaccine to be given, the number of antibodies produced, and the type of immunity obtained. Next, please. Let us concentrate on the most novel one, which is the messenger RNA vaccine, because it is the first time in the world to apply messenger RNA in the production of vaccine. Never had proved by using messenger RNA. It's the first time for the WHO to approve such type of vaccines. It is a rapid and versatile platform, but the problem is that messenger RNA is highly unstable and also hydrophilic in nature. Hydrophilic means dissolve in water in nature, so it cannot cross the cell membrane. Therefore, they develop a lipid nanoparticle encapsulated messenger RNA, encoding the receptor binding domain for the SARS-CoV coronavirus 2 as a vaccine. So you can see usually the other vaccines, they take either the killed vaccines or inactivated vaccines, such as those I will talk about them for other vaccines companies, or a DNA, recombinant DNA or naked DNA, and put it in a large vector, which is usually an influenza virus, which is safe and supposed to be safe and it's a large one. But those working with messenger RNA vaccine, they didn't put it in a large vector. No, they encapsulated them. They take the messenger RNA and encapsulate it with what? With a protein. Sorry, with a lipid. So they produce what's called the liposomes, and they have a very nice and intelligent way to do it. So intramuscular immunization of this messenger RNA elicited robust neutralizing antibodies against SARS-CoV coronavirus 2, as well as Ti-1-based cellular response to produce systemic immunity. So those 2 doses are required, where the first dose gives its action within 21 days, and the second dose is required after that. And we don't know, maybe further doses is required. An important policy and regulatory issues require balancing the safety, speed, equity, and effectiveness of this vaccine. Next, please. This is how the people who are working with the manufacturing process inside the factory, working to produce such type of novel vaccine. They actually, if anybody interested in knowing how the technology applied in the preparation, is a very, and I will put it in a schematic diagram. It is very simple, but it's not simple as it seems to be. So they put the messenger RNA in a lipid, in organic solvent. They mix them together thoroughly, and then they cause filtration to produce the liposome. These are the blue or green dots, and then they filter it. They put it in a vial, and they subject it for lyophilization, for freeze drying to get the final product. So you can see the scheme is a very simple one, but the work is not that much easy. Next, please. The vial of the content of Pfizer-BioNTech and Moderna vaccine These are only different in the type of the messenger RNA used. It's a genetically modified messenger RNA. They produces actually 10 types of messenger RNA, but 2 of them is adapted, one by Pfizer BioNTech and the other by Moderna company. So it contains the vial containing messenger RNA, the lipid. It's actually 4 types of lipids, which I actually applied in my research in producing a DNA anti-cancer drug using the same lipids and the same encapsulation method. That's why I'm interested in, I applied the same method exactly, but for a DNA drug. So it's 4 types of lipids, and then the vial also containing potassium chloride, an isotonic agent to keep it isotonic compound, and we add buffer also to reduce the pain at the site of injection because it's painful if you don't add it, and we add finally sucrose to stabilize the resuspended vaccine. So the vaccine is introduced as a vial containing a dry mass. Next, please. A very important point is that the stability of this vaccine. Now, messenger RNA is very unstable even when coated with lipid, but it is still unstable and dispensed in dry form. Drug makers did extensive efforts and time-consuming thermostability studies started by keeping the vaccine at ultra-cold temperatures, then regular freezer temperature, then refrigerator temperature, and finally room temperature. These are the steps for studying the stability of the produced vaccines. Now, also kept at fluctuating temperatures as a sort of mimic what would happen if a vaccine shipment got left on a loading dock and something went wrong. So Pfizer vaccines should be stored at -70°C and can stay for 6 months stable at this temperature. How did they ship it to reach to the required country or required area? They use what's called pizza box. Actually, in this box, they arranged the vaccines vial in a form of circle, one around the other, just like pizza, and then it is covered with dry ice. The dry ice should be changed every 5 days, up to 15 days, to keep the vaccine at the right frozen temperature, which is enough time for shipping. After that, when it reached to the required area, it should be kept in a special freezer. How did they give it this? How they give it this vaccine to the people? It should be thawed first. How? By keeping them in the refrigerator. It is stable in the refrigerator for 5 days only. Now, when they want to give it to the people, they take it out from the refrigerator and put it on the desk at room temperature. It is stable at room temperature for 2 hours. During these 2 hours, then 1.8 milliliter normal saline preservative free has to be added into the vaccine vial. And then it is just gently inverted for 10 times. Do not shake. That's what we write on the label of the vial. Do not shake, please, the vaccine, because if it is shaken, then the DNA, then the messenger RNA will be destroyed. Then, so it's only gently inverted 10 times, and the vaccine will be off-white in color and ready to be given intramuscularly to the people. Next, please. Moderna vaccine have the same procedure for production, but it's only different in the stability. So it is stable at a regular freezer temperature, -20 for up to 6 months, and after thawing, it can last in the refrigerator for 30 days. It can also be kept at room temperature for up to 12 hours. The vaccine doesn't need to go in and out of the refrigerator each time it is administered. Next, please. Another vaccine which is familiar in the world is the AstraZeneca and Oxford University vaccine. It is a genetically engineered vaccine that causes the common cold in chimpanzees, and it can store transported at normal refrigerated temperature of -2 degrees centigrade up to -8 for at least 6 months. In this case, they use the technology of recombinant DNA technology, which I mentioned, and they take it from certain vector. Now, next, please. The Chinese vaccines, Sinovac and Sinopharm, they used an inactivated, it's a killed viral particles. And part of the coronavirus genetic code is injected into the body, triggering the body to begin making viral proteins, but not the whole virus. It's a traditional method, it's a very old method, but it's useful, of vaccine that is successfully used in many well-known vaccines like rabies. And it can be stored in a standard refrigerator temperature at 2 to 8 degrees centigrade, and more useful to developing countries which might not be able to store large amounts of vaccine at ultra low temperatures. Next, please. This is the difference between different type of vaccines. It's actually the difference in the technology, in doses, in the percent of effectiveness, the storage condition, and in addition to the cost per dose. The most novel one is the messenger RNA. The others have been usually used before in the preparation of other vaccines. Next, please. So vaccine manufacturing requires teamwork involving all the specialties, scientists, industrial pharmacists, quality control analysts to present safe and effective product. Eradication of infectious diseases in general cannot be achieved unless good vaccines are manufactured, and convince the people everywhere to take it to get safe and healthy work. Next, please. Thank you very much for listening. I'm grateful to participate for this beautiful webinar. Thank you.
Thank you so much.
Thank you very much. Thank you, Professor Naval. Really, it is so, we are grateful for your presence with us. Dr. Wael, can you continue?
Absolutely, Dr. Nadia, I'm
with
here.
Our third speaker. Thank you.
It was so interesting presentation. Thank you so much, Dr. Nadal. And she was talking about vaccines and what about, we already got a lot of questions, and, it's kind of argumentative questions. Is it COVID-19, it's a vector diseases or not? So I guess we have a lot to talk regarding to these issues, because this is a vector, but if it's a vector diseases or not. And thank you so much for Dr. Arola for their very informative presentation. It was, she was talking about a lot of what the meaning of vectors, diseases, and regarding to the statistics around the world and around the Middle East especially. Now let's go to Sudan. It's time of Sudan, and Dr. Youssef, let's travel to Sudan right now, and he will talk about the what is the most popular vector in Sudan, and what is the most popular vector diseases also in Sudan, and what about the successful stories of Sudanese pharmacists there. They did a lot, because Sudan, it's a very, very wide place, very wide countries, and the pharmacists there is still, it's kind of war against the vector diseases. Dr. Youssef Sabil, he's a director of planning and the policy department, National Medical Supplies Funds, Sudan, and the consultant of pharmacy practice. So, Dr. Youssef, good morning. Please go ahead. This is your time. This is your floor. Can you unmute, please? We can't hear you. Yeah. Thank you.
Okay.
Please go ahead.
Thanks, Dr. Wael, for introducing me.
You're welcome.
This good, fruitful webinar. I will talk about the disease that most epidemic in Sudan, and that caused by vectors. I choose some of them, not all of them, of course, because they are so too much. Okay, next slide. We will begin, inshallah. Sudan has been facing disease outbreak including dengue, fever, chikungunya, Rift Valley fever, and this is the range I will concentrate on them in this report. The government humanitarian partner activity actively responds to the outbreak according to humanitarian affairs and the
Dr. Yusuf, can you hear us?
increase of the outbreak can be linked to the
Dr. Yusuf, I think you have a bad connection.
Yes, now I have very bad connection. That's great.
All right, please go ahead.
Yeah. Now, yeah, it is better. Thank you, Dr. Yusuf. Close the mic, close the picture, video. Thank you.
Okay, yes, I close the video.
Yes, now you can.
As I said, the increase of the outbreak linked to the recent heavy rainfall in the country, and that have the large pools of stagnant water, which are breeding size for virus type of vector, such as mosquito and house flies. The rain season usually lasted from May, June to September, October. The government authority bodies and the humanitarian partners are actively response to this outbreak across the country, providing health assistance, vaccination where appropriate, and factor control interventions. The UN office also contributed in this. Second slide, please. Second slide, please. So the transfer of disease causing organisms that carry a pathogen from one host to another, and this is done by two ways. The most significant mode of transmission are through ingest a pathogen with taking a blood meal lies within the arthropod as a reservoir. Pathogen is transmitted to another host when arthropod take another blood meal. Another way, by mechanical vector takes the pathogen from one place to another. Usually, this is done or also can be done through
Dr. Yusuf, can you hear us?
Okay. Yes, sir.
Okay.
The
Okay.
voice is the, yeah,
Can you check
now
Victor,
Dr. Yusuf, please.
yes, vector especially carries a pathogen from one place to another, usually on body parts for or through the gastrointestinal tract. Second slide. One of these disease dengue transmitter, and this is actually make more epidemic in Sudan, especially in the east and in Kassala region. Dengue transmitted between people by mosquito. There is two types of mosquito which transmit this disease, Aedes aegypti or Aedes albopictus. More than 1/3 of the world population living in the area risk for transmissions, and over 100 million people are infected yearly and all over the world. No vaccine and no specific treatment. Dengue is characterized by fever, severe headache, severe pain behind the eye, joint pain also, muscles, and bone pain, bone fever, rashes, and mild bleeding, followed by persistent vomiting, severe abdominal pain, and difficulty of breathing. Next slide. The other disease which recently in the last year was epidemic in the east of Sudan also, this is mosquito, caused by mosquito borne Alova virus. This is transmitted also by Aedes aegypti and Aedes albopictus. Main epidemic reservoir are non-human and non-primates. Endemic in Asia and Africa. Circonia virus disease characterized by acute onset of fever, severe polyarthritis, acute symptoms typically resolve in 7 to 10 days. Mortality is rare occur. Mostly in older adults. Variable proportion of patients reported that relapse of rheumatologic symptoms in the months follow acute illness, persistent joint pain for months or years. Often occur as large outbreak with high attack rates, 40 to 60% of population infected. Mortality is also so high, from 72 to 97% of infected persons are symptomatic. Next slides. Do you hear me? Next slide,
Yes,
okay.
yes, very clear. Thank you. Continue.
Please go ahead.
Okay. The other disease, which is well known in the area of Mediterranean, Sudan, Egypt, and various areas, malaria is a disease caused by parasite Plasmodium, which is transmitted by the bite of insect infected mosquito. Only the Anopheles genes of the mosquito can transmit malaria. The symptoms of the disease included fever, vomiting, and or headache. A characteristic malaria fever has hot and wet, cold phases and appear 10 to 12 days after the bite. Diagnosis of malaria done by the slides are examined under a microscope where parasites is seen inside the red blood cells. Rapid diagnostic test kits are used for diagnosis of malaria in remote area. Microscopes cannot be used. Plasmodium vivax or Plasmodium falciparum are the most common malaria parasite, while Plasmodium malaria and Plasmodium ovale other rare form. Of this infection with Plasmodium falciparum, the most fatal if left untreated, possibly leading to kidney and brain complication and even death. Next slide. For the treatment of malaria, chloroquine was used to treat and was the drug of choice at that time and is still used in some countries in the area. It is used for Plasmodium vivax and Plasmodium falciparum. But Plasmodium falciparum recently developed resistance to the chloroquine. Now the artemisinin-based combination therapy is now presently advised to as a primary treatment of malaria. And this is according to the recommendation of the Global Funds. Now in Sudan, we use artemisinin combinations to treat malaria. Among these other things that we are preservative measurements, the use of insecticides, treated net, treated with insecticides at home and indoor residual spraying of insecticides are commonly for malaria, and this is for precautions and prevention of the disease. And this will lead to decrease the exposure to the mosquito. Next slide. The other disease, which is known as Rift Valley fever. I don't know if I said it in Arabic. In Sudan, we say it حمى الوادي المتصدع. Rift Valley fever is also a viral disease caused by Rift Valley fever virus, which is genes Filovirus and family Phenuviridae. Rift Valley fever virus periodically emerge to cause epizootic among livestock and epidemic in person living near. And this is also affect men and affect cattle such as cows, sheep, etc. It is mainly transmitted by the bite of infected mosquito by direct contact with infected animal also. And they product, in addition to Rift Valley fever transmitted as a maintained vertically among both human and vector mosquito population. Rift Valley fever is a viral disease of human and livestock, as I said, and that can cause mild to severe symptoms. The mild symptoms may include fever, muscle pain, and headache, which is often lasts for up to a week. The severe form may include loss of sight beginning 3 weeks after the infection. Infections of the brain cause severe headache and confusion, and bleeding together with other problems. liver problem, which may occur within the first few days. Those who have bleeding have no chance actually to live. 50% of those who are bleeding, unfortunately, they pass away. Next slide. The virus transmitted mosquito factor as well as through contact with the tissue of infected animal. Two species, is known Trineurahydrox and Aedes vexicans are known to transmitted virus. Other potential factors included also Aedes capitis, Aedes Macintosh, Aedes Ocrax, and so several organisms or several species of mosquitoes that transmitted this disease. Contact also with infected tissue is considered to be the main source of human infection, and the virus has been isolated also from bats. Two species of bats, the virus have been isolated from them, and this is bats act as a reservoir. Chance of becoming infected can be reduced by taking measure of decreased contact with the body, with the blood and body fluid or tissue of infected animal, and protection against mosquito and other use of repellent and pet net are two effective methods. No vaccine are currently available for the human. Next slide. Thanks for attending, and I hope that you apologize me. I am working from my mobile because I cannot contact through the computers. Very thanks to you all.
Thank you very much, Dr. Youssef, for this really valuable. Most of these viruses, the first time for me, I'm hearing about them. Thank you very much for your informative things. And I think the role of pharmacists in sharing and preventing and management of these drugs, of these diseases, it shows very clear the intervention of pharmacists in these. Thank you very much, Dr. Youssef. Now we are, I want also Dr. Wael, yes, if you can lead the questions and QE tool, please. Thank you. The floor is yours.
You're welcome. Let's first say Dr. Sharif, he's very apologized because he faced like emergency sick. So he's so sorry to he can't attend today. So hopefully he will be okay. This first thing. Second thing, let me thank you, Dr. Youssef, and all speakers today. She said, and please,
Dr.
as a
can you mute the?
Dr. Youssef, can you mute?
Okay.
Yeah, thank you.
And you can turn off your video, no problem. Your cameraman. And please remember number 16. 16 today is a goal development or development goal, FIP development goal 16, communicable diseases, whatever. And the vector is one of the very communicable diseases everywhere. Second thing, we can't forget, as FIP is fighting now for vaccination, let's say rights for all pharmacists over the world, means pharmacists over the world have a rule, have a right to give all people vaccination. So please ask your patient if he will travel any countries in the Middle East where the vaccines or the vector diseases vaccine, it will save a lot for the people. So thank you so much for our speakers. Let's go to the questions. So please feel free to raise your hand if you have a question, do you want to speak, or you can just write down whatever you want. Please feel free. Probably we had a question from Dr. Nadira. She asking about the vaccines for the children. So Dr. Nidal, can you hear us?
Yes, I think I answered them in the Q&A, but she's asking about vaccines for children 12 years ago and down. There is no available recent data about such ages, but some of the vaccines actually, unless the children, they are highly under high risk. That means they are diabetic or they have certain problems that affect their life. But even those cases, there is no guarantee for any vaccine to be effective or to be safe, at least for these young children about 12 years ago and down. It's not easy to say it. We are waiting for the data from the WHO for that. Thank you.
You're welcome. By the way, Dr. Nidal, we have question regarding to the, is COVID-19 is a vector disease? I know we have a very minimal information regarding to this COVID-19, you know, but let's discuss it. What do you think regarding to the question? Yeah, please go ahead.
Yeah, I say it in my speech in the beginning. We don't know the vector for this harmful, invasive virus. Some of them said maybe it comes from a bat or from a snake or from a meat after eating these or some of these animals. But actually, nobody knows. If we know it, or the people, of course, if they know it, they can avoid such type of invasive virus, invasive disease. But it's not very well known yet. It's only a suggestions, and WHO, they don't have enough data about the source or the actual source of this virus. Is it genetically produced? Is it taken from animals, as I said, or it comes from something else? There's no data about such information till now, because the world is really busy how to overcome this invasive virus and how can we eradicate them, and no information is yet available.
Yes, thank you so much. Can you hear me?
Yes, thank you very much. Is there another question?
Yeah. Okay,
I think there is a question about the pregnant women. Is it safe to give them? Actually, the recent data for the WHO, they can adopt vaccines for pregnant lady. I mean, it's not harmful for the women and even for the fetus. It's not harmful. So you don't have to worry about the fetus, and it's not harmful for the pregnant lady. In Iraq, actually the pregnant women, they avoid to take the vaccines since they have a very good preventive procedures. I mean, they can get away from any people close, but actually they can take the vaccine. Actually, they have a very good, if they have a very good, of course, health, and but they can take it. Yes, the recent data now from the WHO, it is safe to be given for the pregnant ladies, and it is safe for the woman herself and even for the fetus. Yes, thank you.
You're welcome. Thank you, Dr. Nidal. So let's go to Dr. Rola. Regarding the very big effort there in Jordan, you did it regarding to the vaccines and the role of the pharmacists in the vaccines. What about your role in the vector diseases vaccine there in Jordan? And you are academic, because you know you are already in academic sector, I mean section in FIB, and also as a doctor, professor doctor. Please go ahead.
Yeah, thank you, Dr. Wael. Actually, as we always say that we should start from the beginning, we should start from the curriculum. The immunization is a very important issue that we should tackle. And pharmacy students should know the basics of this immunization and how they're going to implement it later on when they work in different sectors. So actually, we are looking at this in our curriculum. We have it already in certain material, but we want to concentrate on it more. And for the practitioners, also we have some workshops in order to certify the pharmacists before they go and immunize. Because as you know, we want them to be certified, to know, to make their competencies or to build up their competencies. Not only the knowledge is needed, also the skills and the attitude. So we are in the JPA, Jordan Pharmaceutical Association. In addition to the academia, as Dr. Wael was mentioning, we are trying to implement the real role of pharmacists. We believe that pharmacists can be a major stone in this immunization issue, which can help not only in vector-borne diseases, but all other diseases that can be very helpful on the health sector. So this is what we are doing. But as you know, we are still in the process. We have achieved a lot, but still we need more. We want the pharmacist to be recognized as the person that he should be among the healthcare team. I hope I answered your question, Dr. Wael.
Yeah, absolutely. Thank you so much. There is Dr. Audrey. He's raised up his hand. So, Annie, can you help us to give him a floor, please? Yeah. Dr. Audrey, I guess, right? Anyway, still, you know, make it unmute, please, Anika. So there's another question for Dr. Yusuf. Okay. Dr. Adia, thank you so much, Dr. Yusuf. Great to know and added to our knowledge in this presentation about diseases in the region, the side of Africa. Thank you so much, Dr. Yusuf, because, you know, you give us like, you know, this is like historical stuff. I mean, geographical. Sudan and Egypt, for example, they are in Africa, and also Somalia and Djibouti, but it's in Middle East. So it's kind of, we have African and the Middle East, both in one, you know. So Dr. Yusuf, he talked about Sudan as in Africa and the Middle East too. Okay, Dr. Audrey, please, can you unmute yourself, please, and go ahead asking? Can you hear me? Oh, yeah, go ahead, please. Unmute yourself. Yep. Yeah. Okay. So, Dr. Nadia?
Yeah.
So we are ready.
Yeah, thank you very much, really. I would like to thank everyone who participate in this event. And really special thanks to Gonzalo and Anken and Mila for helping us and for organizing this event. And special thanks for FIB also, Bureau Office and everybody. Thank you. And we hope also to see you in our next functions. Our thanks, special thanks for our speakers and our participants. Thank you very much. And feel free if you have it will be available in our website, events.fib.org. If anybody want to share this lecture, really, and hope to see you again, inshallah, in our next events. Thank you very much to everyone.
Yes.
Thank you, Dr. Wael.
Thank you, Dr. Nadia. Thank you so much
Dr.
for our
Youssef.
speakers, and thank you for attending.
Thank you.
Thank you, Dr. Farah, Dr. Anikan, Dr. Gonzalo, and Dr. Arola, and Dr. Nidal, and
Everyone.
Dr. Youssef. Thank you so much, Dr. Nadia, and for attendees. See you then, all the future events in FIP. Thank you.
Thank you.
Thank you.
Take care. Bye.